Kids get fractures that are of the long bones, just like adults do, but more commonly they have weaker spots in their bones, the growth plates. They occur in every growing bone, practically. And the growth plate is essentially growth cartilage between an epiphysis, which is bone on the tip of the bone, and the diaphysis, which is bone on the length of the bone. And that's often the weakest point in the whole unit of the bone structure. So they'll often break through those growth plates, which is what makes kids different and which makes the specialty of pediatric orthopedics a little different, because we can't violate those growth plates. We have to anatomically align those growth plates, and we have to be aware of where growth remodeling can and can't occur. Remodeling is the ability of the bone to return to its normal anatomic alignment without the need for manipulation. I think parents should consider using a pediatric orthopedic surgeon when their child has displaced long bone fractures or fractures in and around the joints. I think that the general orthopedist is very capable of taking care of most non-displaced fractures in children, buccal fractures in children, but because of the growth changes in the growth plate anatomy of children, many adult or general orthopedists aren't comfortable with the knowledge of where those are, when they develop, what remodeling potential you can expect, what kind of hardware, if necessary, you can put across a growth plate versus not. So I think particularly fractures around the elbow, where it's a very complicated assortment of 5 growth plates that come together to form the adult elbow, the importance of those fractures or the long-term effects of those fractures can be not completely appreciated by an adult orthopedic surgeon. Even though it doesn't look bad, it may be worse than what it is because we're not seeing the entire bone on the x-ray. If you're on a playground and your child's fallen, injured something, parent has a very difficult role. They have to identify the severity. Is this real, or is my child just being dramatic? They have to determine if there's an obvious deformity, if there's a deformity and blood anywhere. That will help determine what they should do next. I think if they're just sore and aching and crying and there's no obvious deformity, the first step to do is ice, elevate, anti-inflammatories like Motrin. I would argue that if something is bruising and swelling in a child after a day or two, there's something that's happened. Children don't get the typical sprains. They're more likely to fracture than they are to sprain, just because of where the weakness is between the ligaments and the growth plate. If it's swollen and bruised, get to an emergency department or go to your local orthopedist's office. Is it an emergency that you get there that day? If you're ice elevating and have something, no, but within 24 to 48 hours.